Hey there and welcome back. I'm Kristen Galloway, a licensed occupational therapist and dementia care specialist. So today I want to talk about mobility changes that happen with dementia. And of course, this is going to vary from person to person, and it's going to obviously be progressive throughout the stages of dementia. But most individuals who have a degenerative brain condition, such as a condition that would cause dementia, are eventually going to have some type of changes in mobility. So this can be anything from fine motor to gross motor skills, and it can affect a lot of their ability to be able to perform regular tasks that they want and need to do every day. And of course, it can make it a little bit more complex and difficult for the caregiver who is working with them as these mobility changes start. So let's first talk about some of the most common things that you might see with mobility changes in dementia. So one of the earliest things you can begin to see is changes in balance and stability. So maybe stumbling a little bit more often, misjudging distance or depth perception. So again, this is balance is related to not just our ability to kind of stay upright and our strength and our postural muscles, but it's also related to vision. And it's also related to a sense called proprioception, which is our ability to understand where our body is in space. So there are a lot of different things going on that affect balance, but this is one of the things that can obviously increase risk for falls, and it's a huge safety concern. So you want to be on the lookout for changes in someone's balance and stability. And if you do see those kind of changes happening, of course, you want to see a physician or a physical or occupational therapist to get that evaluated and make sure you get the kind of treatment that you need for the person with dementia to make it as safe as possible for as long as possible so that you can prevent falls. The next change that we see is changes in gait, so how their walking patterns exhibit, and then also coordination. So again, this is kind of related back to that balance and stability piece where we see, maybe their steps get a little bit shorter, or they're not able to have their toes clear the walkway each time they take a step forward, or they get a wider stance versus just walking, in parallel like they used to, right? So these are changes that we're looking for to clue us in to something that's going on in the brain that's affecting their movement abilities. So changes in rhythm of walking, so they might get a little bit more like a shuffling. Those are all things that you want to look for because they are going to, again, impact the risk for falls. And so we want to be super careful with that and get that checked out right away. Another thing that can contribute to changes in mobility is spatial awareness. And I alluded to this earlier when I was talking about vision changes, and I have a whole other video that talks about vision changes in dementia. And it's super important to be on the lookout for this as well, because spatial awareness, body awareness, depth perception, and visual acuity, visual perceptual skills, and just the way the brain processes what it is that the eyes are seeing can have a huge impact on someone's ability to navigate around furniture, up and down curbs, and to be able to maintain their balance and stability. And then finally, fine motor skills can also be affected in individuals with dementia. Depending on the cause, particularly Parkinson's disease can cause a lot of fine motor and dexterity changes. And then, of course, the later stages of Alzheimer's and other forms of conditions that cause dementia can also lead to fine motor changes. Also, fine motor changes happen in a lot of just typically aging adults because of arthritis or, other conditions in the hands that can contribute to fine motor restrictions. So certainly sensory receptors in our hands are less sensitive as we age, and so that does affect fine motor abilities as well. So this can be really frustrating, right? So people who've always been able to dress themselves suddenly can't work a zipper or fasten a button. So that can lead to difficulties with toileting. Can lead to difficulties with, simply eating, right? Being able to pick up and manage a fork or a spoon or a knife and keep the food on there and still get it to the mouth in time. Fine motor skills affect a lot of hobbies for people. So people are used to doing, crocheting or handwork. that kind of thing can be disrupted by fine motor decline. And so it can be very frustrating for people who've had a hobby or something that they've enjoyed doing all their lives and suddenly can't do it anymore. So be on the lookout for these kind of changes in a person's mobility, right? So this is not just mobility as far as being able to walk, but this is mobility also with other parts of the body, and how that impacts their daily life and their ability to do things day to day, and how it impacts the caregiver and your ability to support this person to live as independently and safely as possible. So I hope you found that helpful. Those are some of the mobility changes you're going to want to look for and address as soon as you start to notice changes. And in a separate video, I'll go over the different things that you can do to try and mitigate those changes in your own home, and create a safer environment for people who are having mobility challenges. Thanks for watching. I'll see you next time. Don't forget to give me a thumbs up if you like this content and subscribe to the channel so you don't miss any future videos.